Now, you know, on Tuesdays, we touch on health matters, and this morning we're joined by Dr. Kagiso Moloi, who will be talking to us about mouth cancer. Very good morning to you, Doctor, and thank you so much for joining us.
Good morning to you, and good morning, Namibia.
All right.
Today we are going to talk about mouth cancer.
Perhaps before we get to mouth cancer, I
Yeah.
see you are such a big advocate for Movember. For those of us who are not, in the know of what
Yeah.
Movember is, what exactly is Movember?
Yeah, for the past 10 years, I've been advocating for Movember because Movember, men don't get to get special days. They don't have Men's Day. You've got, you've got Women's Day. You've got Mother's Day.
You have Father's Day.
We have Father's Day, but you even forget to buy us presents.
Wow.
So, the attention in November it should really be to men. What we are saying to men that you must go for your annual checkup, to go do your annual checkups to check your general health from head to toe. By head, I mean you must look at your scalp, you look at your eyes, go to your optometrist to check whether your vision is okay. You go to ENT, but all that will be referred by a GP who has identified any problem in those. So November was identified as a mustache November,
Okay.
where men with mustaches like us and lot uh, can preserve without cutting it.
So no
And
shave November.
no shaving the mustache in November, and we call each other Mo Bros.
Okay.
Yes, yeah. Basically, that's just a highlight to highlight the men's health. Coming to today's topic.
Yeah, mouth cancer. What exactly is mouth cancer and how does it develop?
Yeah. Mouth cancer usually it starts by affecting what we call squamous cells in the mouth. So we call it squamous cell carcinoma.
And where exactly do we find the
We
squamous
find
cells in the mouth?
this on the skin,
Okay.
the whole skin. We find squamous cells, and when we talk about mouth cancer, we're starting on the outside of the mouth. So you'll see a non-healing ulcer. If you've got an ulcer, and it goes beyond 10 days without crusting, usually we have ulcers. We've got herpes simplex virus ulcers that
So perhaps in layman term, ulcers is wounds?
yes,
Okay.
ulcer is a wound. Yeah. So usually we have herpes simplex, which are fluid filled, and when the fluid crusts, you end up with an ulcer. So it's an open gaping wound. So this, you must get worried. You must go to see your GP,
Yeah.
or more especially your general your dentist,
Yeah.
to be
Apart
able
from the
to be able to take a biopsy and send it to the laboratory to see whether this is not cancerous.
yeah, apart from that ulcer, what are some of the other early warning symptoms that people should look out for?
Early warnings, you start seeing, you'll seeing it's a wound which is starting to crust. Yeah, the wound that is starting to crust, and it's also not healing.
Yeah.
Yeah, and also you'll see white patches on the side of the tongue. White patches on the side of the tongue, and you see a gaping big ulcer in the tongue.
Yeah.
Yeah, and when it reaches the stages, it is more advanced. So you must if you see something reddish in your mouth, something painful, a non-healing ulcer, you must just get worried and go to see your dentist.
Yeah. Apart from the wounds that are on the tongues, inside the mouth, and also on the lips themselves, anything else that affects perhaps the teeth and the gums?
Okay, I've got an X-ray here. X-ray, you can see there's a darkish, we call it radiolucent picture on the X-ray.
Yeah.
You see somebody who's swollen like that, and this is usually not painful. So if something is not paining, especially men, something that doesn't pain, it doesn't bother them.
Yeah.
And you see swellings in the mouth. This is called amyloblastoma. This you see it nicely on the scan here. This is a three-dimensional scan where you can see that the bone has been displaced, teeth have been displaced, a person starts not being able to eat, and teeth become loose, and this amyloblastoma takes a while to grow. So people just say, nah, it'll go away.
Yeah.
So it is good that you see your dentist every 6 months so that we are able to take x-rays as often as we can to be able to see whether there's anything that is developing. Because this thing is not painful, we tend to not to worry.
Yeah.
A person only gets worried when there's pain. Even with the dental pain, even if there's decay in the mouth, they just ignore it until it pains.
But what's the treatment process?
The treatment process of
Mouth cancer, yes.
of mouth cancer. Let's start with squamous cell carcinoma. The squamous carcinoma, the things that you must avoid is smoking, it's alcohol, and then there's something called human papilloma vaccine. You just go for the vaccine. It will reduce the chances of having the cancer, and also avoid direct sunlight in case of the mouth from the outside or the skin, and put SP high
Sunscreen, yeah.
high ultraviolet sunscreen with SPV more than 50 to make sure that you prevent the cancer, and also avoid smoking, whether it's a pipe, whether it's a snuff, the one that they put under the tongue,
Yeah.
the brownish one, and also it's not much in Africa. In India, they like chewing tobacco. So if you're chewing tobacco, just avoid doing that to reduce the chances.
Yeah. Doctor, smoking, pipe, all that, these are some of the specific habits and factors that actually increase the risk of developing mouth cancer?
Yeah.
And what else?
What happens is that what they do is that they cause mutation of the DNA. As they cause the mutation of the DNA, so the cells don't grow in the right way. The cells that start going haywire in the way they are developing and growing, and that's why you end up with the cancer.
Yeah. But how common is mouth cancer and who is at risk, mostly at risk of getting it?
As I mentioned, smoking, people who are smoking, and excessive drinking of alcohol.
Is it quite common?
It's very common. I think one in 10,000 people in Namibia would have a cancer.
Yeah. Now, for those of our viewers who are watching this morning, what message or what are your doctor's orders for them?
The doctor's orders is that let's highlight this month as a month where we go for our annual general checkups, specifically for men. Let's just go for our annual general checkups to check everything, as I said, from head to toe, and let's just take care of our health.
All right. Well, doctor, thank you so much for joining us this morning.
It's always a
And
pleasure.
we are definitely celebrating men. We're dedicating the whole of November to men.
Yes, as Lot said, we don't have many days where dedicated to us, and I think that let's celebrate this whole month as a month for men.
Yeah, we'll give November to the men. Well, thank you so much for joining us and all the best.